So what's your name?
Rachel Kane.
Hi, Rachel Kane. So what were you dealing with when you first came in or before you came into Simply Health?
Prior to the first time of seeing Dr. Bryan, I drive for a living as a sales rep, and the continued position of sitting in the car had left me very, very sore in my back and pretty much unable to do much of anything after I would get out of the car. And then about a year ago, I was in a car accident, and that kind of messed up my neck. So I had two different things that I was dealing with.
Wow. Okay, craziness. So how are you doing now that you've been coming to Simply Health and seeing Dr. Bryan?
It's been absolutely wonderful. I can move, which was the biggest thing to start with. I no longer have, when I was in the car accident and it messed up my neck, I had a big knot on the side back here, and I no longer have any of that. It really helped with the headaches that I got from the car accident. I no longer have those. I don't have any issues with my legs or anything like that, with my lower back being sore, things of that nature. It's pretty much alleviated any issues that I've had.
Yeah,
it's absolutely wonderful.
That's wonderful. Would you recommend this office?
Most definitely.
Absolutely.
Dr. Bryan is great. Stacy's great. Everybody's wonderful.
Awesome. Thank you.
In Healthy Living, we learned some news today about a problem affecting half of all of us in this country, neck pain. A new study about how to fix it. Here's ABC's Dr. Richard Besser.
Think about it. It holds up your head, moves it thousands of times a day. The strain from poor posture, tension, long hours at a desk. It leaves a lot of us with a pain in the neck. For Charlene Von Saer, it was the daily grind in front of her computer.
It was terrible. I couldn't exercise because of the injury. I couldn't rest because I couldn't get comfortable.
She did what most people do, took pain medication. But today's study argues not so fast. Of 272 patients with neck pain, one group got medication, another exercise, a third visits to a chiropractor. After 12 weeks, only 13% of those taking pills reported no more pain, while more than twice as many who exercised or used a chiropractor were pain-free.
Hi, I'm Shannon Hurley. I'm a personal trainer, and I came into Dr. Bryan for several issues. I had issues with my foot, severe shoulder and neck pain, and some severe hip pain. I also had IBS type of issues going on, and I've been coming to him for a couple months now, and within the first couple visits, my neck and shoulder pain went away, and we found out that my foot was fractured, and we've been treating my imbalance that way, and my hip just finally it alleviated just recently in the last week. But my gastrointestinal issues, within a couple of weeks, I lost 7 pounds of bloat that went away, and I feel much better. So I definitely recommend Dr. Bryan to anyone else.
Wonderful. Thank you, Shannon.
Well, doctors aren't quite sure how it happened, but a Dubuque man can see clearly tonight after being blind in one eye for more than a decade. KCRG TV9's Dubuque reporter Katie Wiedemann says it happened after a trip to the chiropractor.
12 years ago, Doug Harkey's left eye suddenly stopped working.
Just woke up one day and I didn't have no vision in my left eye.
And as quickly as he lost his sight, he got it back.
He just did his normal adjustment that he normally does, and voila.
After a routine visit to chiropractor Tim Stackis, Harkey says a miracle happened.
My blind eye started watering after I left there, and it watered for like 45 minutes straight, and got my right eye watering. I went to wipe my right eye, and I could see out of my left again.
Dr. Stackis said the bones in Harkey's neck were out of alignment.
That interferes with the messages and energy that the brain sends down to the rest of the body.
Harkey now has the depth perception he'd been missing, just what he needs as he's about to walk down the aisle with his fiancée next month.
I'm not used to him not running into things or stepping on her feet.
Dr. Stackis and Harkey were both surprised by what happened.
He has miracle hands, I guess.
Was it a miracle? No one knows for sure how to explain it. Harkey's just glad it happened. In Dubuque, Katie Wiedemann, KCRG TV9 News.
Hello, I'm Kim Haywood, and I have been coming to Dr. Bryan since, I want to say, January. The reason why I started coming was because I had tingling in my hands. I did have other medical problems, but never thought that getting adjusted would help those problems. The last, I want to say 2 years, I've had bronchitis 8 times, pneumonia 3 times, a collapsed lung, a bacteria infection in my lung. It was all in the same lung. In 2009, I had a blood clot that my doctors did not know where it came from. So with all that said, I had a whole lot of problems. Started noticing a difference right away as soon as I got my first couple of adjustments. But the one thing that I really appreciated was I started bringing my kids. For a while there, my kids were alternating days going back and forth to the emergency room. Actually, both of my boys and myself, we were in the ER a lot. I did not like giving my children a lot of medication because of the side effects, and then they would end up being sick again. So since we've been coming to Dr. Deloney, we have not had an emergency room visit. The boys have been doing great, so have I. When I was sick, of course, no energy, having a hard time breathing. I chase my kids down now. We are doing a lot more as a family. And another thing that has been really great is that my husband started coming because he was having problems as well. And he was like, I'm not going to go. But then he started coming, and now he has noticed an improvement in his health. So with all that said, as much experience as I have had, being a patient, but then also working in the hospital as a technician and seeing what medication, the benefits and the misbenefits of those, being adjusted has been one of the best things that I could have done, not only for myself, but also for my family.
Wonderful. And would you recommend Dr. Brian with all that said?
Of course I would. I think that he is a very good doctor. He's very attentive. He listens. That's very important. And it's not like you need to do this or you have to do this. He gives you that option, no pressure. And it's not like he's trying to sell it. He's just laying it out there, and if you want to do it, great. If you don't want to do it, that's fine. So I would recommend for anyone to come to him, and to me, it's the best thing you can do.
Awesome. Thanks, Kim.
In this morning's Health Watch, if you've said, oh, my aching back at some point in your life, you are not alone. A new Consumer Report survey finds 80% of adults, that's 8 in 10, have experienced back pain. It took an average of 5 or 6 treatments to alleviate the problem. Our own Dr. Jennifer Ashton is here with some advice about this. Now, this is not science. This is a survey, correct? Right? And what's the takeaway here?
And this is telling us what I see every day in my practice. This is the most prevalent, common incident in ailment in this country, and it's also the most difficult to treat. So if it doesn't affect you now, chances are good it'll affect you at some point.
People in the survey said the thing that worked best for them was?
Believe it or not, hands-on therapy. So they're staying away from things like medication, prescription drugs, or surgery. They're pursuing things like acupuncture, chiropractic adjustment, massage, things like that, which is interesting.
My name's Jack Loyne. I've been coming to see Brian for about 2 years. I had chronic lower back pain. I couldn't even bend over to tie my shoes, wash my feet or anything. I was really miserable. After just a couple of adjustments from Brian, I began feeling relief from the back pain that I had all my life, and within probably 6 weeks it was gone, and it hasn't been back since then. Not only that, my back used to go out probably 4 or 5 times a year where I couldn't even hardly walk. And since I've been coming to see Brian and getting adjusted on a regular basis, I haven't had that problem either. So I would say that I'm a pretty happy camper.
Wonderful. And I guess you would pass on a recommendation to anyone?
Absolutely. It's been wonderful for me, and I would recommend anybody to give it a try. I think it's beneficial, definitely.
All right, it would behoove us, helping pregnant women stay comfortable during their pregnancy, help them avoid difficult labor or unwanted C-sections. I had 39 and a half hours of labor,
you know what?
So I can relate to this story.
Yes, you can. And the men can relate just because they have to be there with the wives. But sounds like a tall order. Our guest today, Dr. Elliot Berlin, says it can be done. Okay, the obvious question, Dr. Berlin, thank you for joining us, first of all, is how?
Well, the first thing starts with pain. Pain during pregnancy is not normal. It's very common, and so a lot of women think it's normal. I'm pregnant and I'm uncomfortable and there's nothing I can do about it. But especially if the pain is around the pelvis, the low back, the hips, the buttock, the pubic bone, that's an indication that your pelvis isn't functioning quite right. So the muscles are too tight and spasmy, or the bones are restricted, and that can create a problem for you on Labor Day.
Hey, Dr. Berlin, now you have the Berlin Wellness Center, and of course you have acupuncture there and chiropractic help for women who are pregnant, which I wouldn't think of during pregnancy.
Yeah. Chiropractic, acupuncture, and massage, yoga, anything that you can do to normalize the pelvic structures, to loosen the muscles and bones so that they don't restrict the natural passage of the baby during labor and delivery. They also make you exceptionally comfortable during pregnancy. Our patients generally enjoy a very comfortable pregnancy and maximize their chances for a safe, traditional labor and delivery.
And again, it's all about managing your pain. How many pregnant women out there are in pain?
Oh, tons. I mean,
yeah.
Well, and how do women, and this is a big thing with a lot of women, avoid unnecessary C-sections?
C-sections, a lot of the reason for the rise in C-section are because babies can't pass through. You have breech babies that can't position well. You have babies that get stuck or prevent labor from initiating on time. If we do things like open up the pelvic bones, relax the pelvic musculature, do a little training before the big day, you maximize your chances for that safe, uncomplicated traditional birth.
Okay, that's interesting. I always thought that the increase in C-sections was because a lot of mothers are choosing to schedule their births.
That's actually just a small number. Small number of elective C-sections. A lot of them are being indicated by the baby's inability to drop.
Dr. Berlin, a lot of useful information in a short period of time. I really appreciate you squeezing it all in, and you're coming in as well.
My pleasure.
Dr. Elliot Berlin of the Berlin Wellness Group.
What's your name?
Keenan Collier.
All right, Keenan, how are you doing today?
Fine.
Good. So what were you dealing with before you came into the office here at Simply Health?
A pinched nerve in my right shoulder.
Okay. Anything else? Any other back?
Couldn't turn my neck as much, couldn't move my shoulder, wasn't able to sleep at night.
Okay, and you had mentioned lifting before where you weren't able to...
I wasn't able to lift heavy weights.
Okay. So how are you doing now that you've been coming into Simply Health and seeing Dr. Brian?
Better. I can sleep at night. I can sleep on my side, on my back. I can turn my neck. I'm able to do pull-ups.
Wonderful.
Yes.
Wonderful. Resume normal function, right?
Yes.
So would you recommend the office here?
Yes, I would.
Awesome. Well, thank you so much.
I've had back pain on and off for at least 5 years.
We're going to really evaluate where this pain is coming from, because the pain may not be what you think it is.
If you've tried everything but your pain still isn't going away, don't give up, because the pain may not be what you think. And our next guest is desperate to get rid of her lower back pain once and for all.
Hi, doctors. I've been suffering from chronic lower back pain for what seems like forever. I get massages, but the pain always comes back. This is taking a huge toll on my life. Is there anything you can do to help me get rid of this pain? Please help.
Well, Beverly went to see chiropractor Dr. Fabrizio Mancini at Parker University in Dallas, Texas. Let's see if he was able to get to the bottom of her back pain.
So what we're going to do today is we're going to really evaluate where this pain is coming from, because the pain may not be what you think it is. One of our technologies that we use is called Insight Station, which is going to tell us what the autonomic nervous system is doing. And then number 2 is called the surface EMG. We're recording the electrical activity of the muscles. This is the latest technologies in custom orthotics in the world. We got to know if the source of the pain is coming in from the way that we're distributing weight in our feet.
She has 50% more weight on her left than her right.
So Beverly, what we found in your exam is that you had 4 segments in your spine that were out of alignment. The first one was your pelvis, the second one was in your low back, and we noticed that in your upper back and in your neck, there's some activity where the muscles are very tight. So Beverly, now we're going to give you an adjustment. That's what makes chiropractic a very different approach. We look for the cause of the problem, not just the management of the symptoms of the problem. Here you go. Perfect.
Yeah, I love that.
I'm here with chiropractor Dr. Fabrizio Mancini from Parker University in Dallas, Texas, along with Beverly. Thank you both for joining us.
Thank you so much for having us.
And so you've been having some treatments. How are you feeling now?
Oh my gosh, I feel so great. I travel a lot, and on the trip here, I was just like, oh my gosh, I got off the plane and I didn't feel like a pretzel.
Which is good, and I think, today's show is all about the pain may not be what you think. So, Dr. Feb, let's talk about what pain often is in your back that may not be what you think.
Well, and in her case, it was primarily her travel schedule was putting a lot of undue stress into her spine. But also we found out that she had a couple of accidents that were not addressed properly and corrected, and they were just showing up now later on in her life. And then we did the chemical evaluation, in which is her diet. With the travel schedule that she has, she's not eating properly, she's got too much sugar in her body, and that stresses the nervous system, and that can also create inflammation that shows up as pain. And then the last one was the emotional component of the stress. And the emotional was that she started a new business, she wants to help a lot of people, she's got a lot of stress in getting this business going, and all of that tension builds up in our spine, and that causes an underlying cause of why the pain shows up.
Well, and it's interesting you bring this up, because stress can not only just increase pain in general because of the environment that it creates around you, but stress has a physiologic effect on our muscles. If we're constantly stressed out, we've all felt this way, right? It's like, take a deep breath. You take a deep breath and everything relaxes a little bit. But when you're stressed out constantly, it can reflect itself in these areas of pain.
Absolutely.
And I love that you take a multifaceted approach here, because again, it's all these things combined. And you actually brought one of the devices that you used on Beverly,
yes,
is that right?
One of the things that I had to share with Beverly is the fact that the pain is not the problem. The problem is the fact that the body communicates through the nervous system, and it just lets us know that there is a problem inside. But the pain itself is not the problem. And when we see the animation of the nervous system, we see that the pain travels all through the brain, throughout the whole spinal cord, and it shows through all the impulses that are communicating back and forth from the body to the brain and the brain to the body. But I also know that there's so many individuals, so we're trained to actually find the cause of that problem, which we call subluxations, which are the misalignments in that, and then we just correct it. And I know that there's some people that are afraid to go to a chiropractor, because sometimes they see that the noise that is produced after an adjustment is a little bit scary. But what I did with Beverly is also I introduced this unit that is called an activator. And it's a very simple unit that has a very little rubber end. And then we just went to the little segments in her spine, just like that. And that allowed me to correct the misalignments and the subluxations, and that's what gave her the relief that she now has. Because the cause of the pain was not necessarily in her back. Actually, in our exam, we found out that most of her cause was coming from her upper back and her neck and some of the other stresses that we found chemically and emotionally.
We are so happy that you're feeling better.
Thank you so much.
That's what's most important here. Thank you.
So go ahead and I guess just tell people your first name, and then just let them know just how it all started.
My name is Joe Chrysostomo. I've been friends with Brian since we were kids. We hadn't seen each other for a while, me being in the military and him going to school, becoming a chiropractor. We hadn't seen each other for a long time. We met up one day at a gas station. It had been a couple years since we had even talked, and he asked me how I'd been, and I told him just haven't been myself. I've put on I was weighing about 230 pounds, the most I've ever weighed. Could barely walk, had a pinched nerve, 2 deteriorated vertebrae in my lower back, and could barely move. I mean, just to pump gas or get out the house was a chore. Like, I didn't even want to get out of bed most of the time. He asked me to come down and get adjusted and see how it felt. And never seeing a chiropractor, I was kind of hesitant because, everybody else, your real doctors, out there that you go see and just manage your pain, they always tell you otherwise. So I was kind of skeptic. So after a couple weeks, I called them up and said I wanted to come in, and I did. And after the first adjustment, I was actually able to feel my left leg. My left leg was really numb for about 1.5 years, and it just kind of amazed me that I had like normal feeling. So I was kind of like, wow, that's a lot more than any other doctor's done for me, and I don't even have to take medicine. So I continued to see him. Actually, I still do. We've been going on about 2 years now, and within the first year, I dropped about 55 pounds, from 230 to 175. So
So I've been able to maintain around that weight. And now I'm actually able to get out of bed, pick up my kids, play with them. I'm back into playing golf, sports, any other sports with my children. And back then I just didn't even know what I was going to do. Since I was retired military, the only thought in my mind was, how am I going to get disability? Now it's like, I don't even think about it. Now it's like, now I'm in school, about to graduate with my bachelor's degree, been playing golf, been playing really hard to get into like an amateur tour. So it's been a big difference from not wanting to even get out of bed into like, what do I want to do now? But it's affected my life drastically in the last year and a half, and I'm just so amazed. I know he's my friend, but I will tell the truth. It's been remarkable. Everybody I meet, whoever has an issue, I tell them go see my friend. You know, it will make a difference.
Awesome. So, yeah, that's cool. And just to tell the people, I don't know how long this testimonial is going to go on the video, but you know, when I saw you walking up at the gas station and you were hobbling, man, it was because we hadn't seen each other in so long.
Right.
It was just kind of amazing to me to see where you were at. You know, I was just really concerned. But I'm glad you decided to come in and see what can be done. And I'm excited for you because just watching you over the past 2 years, the doors are open, and it's like the future's wide open for you.
Oh, most definitely.
So cool. That's it.